My name is Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, treatathon, the Lupus Day, Volume 2, how snoring leads to erectile dysfunction involved in penile erection. So now, how does snoring now affect how does deep snoring lead to erectile dysfunction? Now, the first way such can happen is by psychological. Let me start with saying that for the mere fact that you are around a partner and you are snoring deeply, it irritates the partner. So it can lead to problem with sexual attraction. And when there is sexual attraction, all other psychological or psychiatric symptoms will start coming out. When the snoring partner discovers that his partner is not attracted to him, even if there's going to be a sexual intercourse, the person will be depressed. The snorer will be depressed. So depression sets in. The next thing, there will be anxiety of performance. So in this way, it's already leading to erectile dysfunction. The partner will not be able to maintain erection because he's depressed, there's anxiety, he feels not attractive enough for his partner. So that is one. The next one is if there is homeostatic imbalance. That is, the homeostasis now that produces the hormones of the body. If there's homeostatic imbalance from that sleep apnea. Now, in this homeostasis, the normal thing is that the body produces testosterone that helps in all those maintain all these other things. So now, when there is this particular problem I just listed now, the brain, that is the hypothalamus, that should produce cortisol. What now happens is it should be able to moderate the cortisol, but it now produces high amount of cortisol, which is, of course, because the body is already under a stress. If you can't sleep well, if you're having sleep apnea, you're already stressed out, and in stress, the hypothalamus, the brain produces cortisol and adrenaline. So in this time around, it produces cortisol. What does cortisol do? Cortisol then starts struggling with testosterone over binding. So it invariably now suppresses testosterone production and even estrogen production. So this, of course, and indirectly, it can also even affect dopamine. And what does dopamine do? Dopamine is responsible for regulating sexual drive. So it is dopamine that helps you to have the desire to even go into into sex. Then testosterone. When testosterone and estrogen is suppressed, what does it lead to? It leads to low libido. There will be low libido. You will not have a desire for sex. There will be poor erection, and there will be reduced infertility because sperm will not even be produced. This is just sleep we're talking about, to how snoring that is resulting from obstructive sleep apnea is leading to erectile dysfunction. I know most of you didn't know such things can happen, but it's happening now. So the next one is the next way snoring from obstructive sleep apnea can affect erectile sexual dysfunction. Erectile dysfunction is snoring on its own from obstructive sleep apnea can result in metabolic syndrome, hypercholesterolemia, hyperlipidemia, hypertension, and hyperglycemia. So now, these things I mentioned, of course, will lead to cardiovascular coronary artery diseases, especially the one we know as atherosclerosis. And when this happens, what do? They damage the vessels such that the vessels of the penis will now become permanently contracted, so it cannot relax anymore. And remember, relaxation is needed for erection. So it's already damaging that particular part. Then diabetes can lead to depression. So the diabetes that it forms, that the hyperglycemia it forms, will lead to depression. Depression will lead to erectile dysfunction. Diabetes on its own can also lead to atherosclerosis. That can also lead to permanent contraction of the smooth muscles of the penis and lead to erectile dysfunction. Then polyuria Polyuria from diabetes can worsen sleep. Now imagine you are snoring, which is making you sleep and wake, and then you have diabetes too, that is as a result of that, of the obstructive sleep apnea. And then diabetes makes you have so much sugar that you're having polyuria. You need to wake up like 6 or 7 times to go and urinate. So that means you can't even sleep at all. So it's really resulting to sleep deprivation, and it goes round the cycle to still result in all these things we've listed, leading to erectile dysfunction. So now, the next other thing I want to talk about is hypoxia. Now, prolonged hypoxia on its own can lead to so many other things that will still result in erectile dysfunction. I am not here to teach you how to resolve snoring, but if you need that, please make the request in the comment below, so that I will now go into that very one. It's the management of snoring or obstructive sleep apnea or erectile dysfunction is beyond this scope. But I have made so many other videos in erectile discomfort, in erectile dysfunction. So if you go through my videos, YouTube videos, Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, Tritathon, the Lupus Day, the Lupus Day, the Lupus Day.